The Love and Leary podcast is where nursing leadership, innovation, and real talk come together. Hosted by nurse leaders Marion Leary
and Rebecca Love.
The show dives into the issues that matter most to today's nursing community.
Each episode features candid conversations, expert insights, and bold perspectives on healthcare, leadership, advocacy, and the future of nursing. Whether you're a clinical nurse, nurse leader, or another healthcare changemaker, Love and Leary offers thoughtful dialogue and practical takeaways to inform, inspire, and empower nurses at every stage of our careers.
Hello, Rebecca.
Hey, Marion.
I am so excited for our episode talking about why we need nurses in the media.
Yeah, no, I mean, you know, this is an absolute crisis. Most everybody else speaks on behalf of nursing except nurses, and it's all going to tie into this whole debate and interesting research done around the Woodhull study. And I think this is a really exciting time to be having this conversation. And I think actually it's our first time that we're going to be having a guest to the show as well. So this is very exciting from that perspective too.
Yeah, for sure. There's so many ways for people to consume news and information. We have this nonstop 24-hour news cycle. We have multiple social media sites that are constantly putting out information that you don't know if it's verified, if it's true, if it's fake news. And one of the biggest concerns, and this came up during the pandemic, is who do you get reliable health information from? And, what we saw during the pandemic was some nurses were being used as content experts, but not many. And, I think we really want to focus on how can nurses use their voice and make their expertise known on all of these platforms, not just on social media, but with print news and TV news and, all of these places. So it's going to be a really interesting conversation.
Looking forward to this. And I think we also have a big announcement as well. This is exciting for us too.
Yes, big announcement. So the Nursing Beat is now the exclusive media partner of the Love and Leary podcast. And for those of you who don't know, what the Nursing Beat is, you should definitely check them out. And I'm going to scroll their website across our screen. But they are a nurse-run, for the nurse, by the nurse media site that puts out short daily rundowns of the most important news and information that impact nurses. And I've been on their advisory board for the past year, and we're really excited to be partnering with them on this podcast.
It's about time that there's a nurse media company. I'm super excited to be joining the team. And I think that what's going to be really exciting is the impact that this entire nurse media effort and initiative can take off in terms of driving the future of where nurses sit in media. So we're excited. Please check us out on the Nursing Beat. And you guys, I think it's going to be the start of really amplifying the power that nurses have in the media. And speaking of nurses in the media, today's guest is one of the leading nurses that have led that charge of nurses being in the media. Please welcome Barbara Glickstein. We're so excited to have you, Barbara.
Well, first
Barbara,
of all, congratulations. Congratulations on your Nursing Beat media partner. This is freaking awesome.
I know, it's great. We're really excited. Lots of new things today. You're our first guest, like Rebecca mentioned on the podcast. We get to announce our partnership with the Nursing Beat. All good things.
And I think the most important thing is bringing you on as one of the foremost experts of nursing in the media. You were personally involved in the second Woodhull study, which is, if you can just give us a little bit of your background and then dive into the Woodhull study, Barbara. I think this is really set the table for us.
All right. So I'm a public health nurse, and media is my public health practice. I practiced clinically for a very brief period of time, and I was in the late 80s during the height of the HIV/AIDS epidemic. And I was a new nurse, and I was so green, and there was no residency programs. And I was trying to organize the nurses who were taking care of 19 and 20 patients who were all before, AZT and medications. And I was like, we have to go on strike. We have to mobilize. We have to stop this nonsense. And everyone was like, we don't have a choice. We don't have a choice. They were working incredibly hard. They were incredibly brilliant. And I said, I'll see you. I'm going back to graduate school. Because I have to be on the policy side and figure things out on how to change things. And I got to do a documentary film. It's a longer story, but it was on nurses in political action. It was a really crappy talking head piece, but it was my venue to get into media. I was interviewed by nurses who had their own radio show back in the 80s called Every Woman's Space. And after I was interviewed about my talking head documentary, which featured 4 nurses who were critically important on policy issues in New York State and covering domestic violence, access to for people who were homeless and living with dual diagnosis, that I said, I want to do this. And they said, okay, join our collective. And I did. That included Dr. Diana Mason, who has been my work wife for almost 40 years now. I got her a pillow that says work wife that she uses behind her chair. And we have both been very, very interested in amplifying the expertise of nurses. And there was a Woodhull study, as you mentioned, Rebecca. We published our study in 2018, 20 years earlier. The first Woodhull study was done. And for those of you who are interested in reading the 2 published articles, you can go to the George Washington University Center for Health, Media, and Policy Health Policy and Media Engagement, and read both studies. There's one study that looks at the data that was published in Sigma Theta Tau's journal that compared the outcome, which did not change, sadly, in 20 years. And the second study, which we almost feel was as important, if not more important, we interviewed 10 health reporters about their experiences either using nurses as sources for expert sources, and or who didn't and why not. And we basically, after about 12 reporters, we had kept hearing the repeated things. We didn't know nurses did research. We didn't know nurses did other things in addition to bedside nursing, which of course we have tremendous respect for our colleagues in bedside nursing. They didn't know how to reach nurses. These are some of the key themes. Their editors often would say, don't talk to a nurse, you have to talk to a physician. And so it gave us a lot of data and a lot of information to get fired up like you 2 gals and say, basta, we've had enough here. What's our strategy? On what lanes are we going to start moving in order to create what I like to call as the nursing media movement?
So, love that.
I love that. Yeah, I mean, it's crazy, right? Let's set the stage a little. Nurses are considered the most trusted profession for the 22nd year in a row. Yet nurses are rarely recognized by the public, by journalists, or even like on social media sites as subject matter experts. You mentioned some of the reasons that you were hearing during the study, but I'd love to know why you think that is. I mean, I have lots of opinions on this that we can talk about. I think nursing as a profession does a terrible job at promoting itself as experts in all of these areas. But I'd love to hear your thoughts on that.
Well, I think, we're mainly female profession, that those numbers are slightly shifting, but it's still significantly, female identified, or by, the way one identifies is an influence on their power in the hierarchy of healthcare. So I think that's number one. I think sexism exists not only in the healthcare system, but in the media system as well. The fact that really seasoned health reporters didn't know that nurses did research meant they weren't looking for research in the nursing community. And one story I like to share is one reporter was a senior health economics business reporter. And he said, why would I interview a nurse? I cover the business of healthcare. And it was during the qualitative studies part, so we had to wait and bite my tongue until the recording ended, and then reminded him that in hospital systems, that the chief nursing officer has the largest budget, that she mostly, or he, controls that budget. So for you not to talk to that level of leadership about where expenses are, how are they paid, why are nurses, this is your area of expertise, Rebecca, why are nurses a budget line that's not one of, that should be different? And it was a wake-up call. And I think for most of the reporters, both Diana and I are members of the Association for Healthcare Journalists, and we have now had panels. We insist and nudge to make sure that there's a nurse on their expert panels. when they have their annual meetings. The younger journalists who we have a chance to talk with are beginning to understand that, and not just the younger ones. Many of the women journalists understand it. They have their own issues of sexism in the media world. So that's one thing. So on that side, on the media side, we have power hierarchy, we have sexism, and we have a lack of understanding. There are a lot of marketing directors in hospitals who have no idea what nurses do. Yeah. So we can't only blame it on that. And then we have the professional nursing organizations who are not necessarily educating their membership on the role of media in advancing population health. It can't just be about nursing. It has to be the focus of why the public should care about issues that we are capable of translating into a public concern, right? You don't have a nurse staffed in the ICU for your loved one's care. The outcomes are going to be very poor. So there's the professional nursing organizations who, unlike in the medical associations, most of them don't have the budget or the know-how to send out press releases about the research being published in their journals. And they're also not necessarily training other people besides the maybe president or the CEO, and they're saying the same thing in every interview. I'm sorry, Rebecca, you wanted to chime in.
Well, I think you're saying this so well. And the things that I struggle with, right, is to your point, we don't have media training. It's not something that is built into our own nursing education programs. We largely don't understand the business of healthcare. So we are invisible in these conversations. But during the pandemic, Barbara, I remember we were engaging a lot with you. You were out there speaking. We saw more nurses being interviewed in the public. But I remember one of the feelings that we felt most frustrated about was even during the pandemic, the nurses being on the front lines, everyone else leaving the hospital systems. There was a largely showing of nurses from a position of being very disempowered, very fragile in terms of their mental health, but at the same time applauding them as heroes going in. My question to you is how has the COVID pandemic, do you feel that pandemic hurt, helped, elevated, or shifted the conversation? And if so, what lessons could we take out of that, and where should we be going in light of what was occurring during that time, where every time you turned on the news, there was some kind of nurse in the midst of the pandemic, however, what health system they were being shown at. But the question that I always was left with was this feeling that still these nurses had a voice, but many of the conversations did not necessarily put them in a place that elevated their subject matter expertise, as Marion would say, to being the ones leading us through the worst, pandemic in over 100 years that this world has seen. But what's your opinion?
Anecdotally, I can tell you that we were watching trends, particularly across the country, where when the epidemic or the pandemic was at its height, you would see nurses. As things started getting better in that state, you saw less nurses. Also, as you said, Rebecca, there was shown in a vulnerability. There was a lot of and of course, this is critical to be voiced, lack of PPE, wearing the same mask for days, taking the mask off and showing the indentation on their faces. Did we hear from the infectious disease nurses who were critical to the care and diagnoses? Did we hear from the ICU nurses? Did we hear about the nurses who created interventions and innovations of ways that care was delivered? Very little. And then we also saw at the end of the heights of these peaks, we didn't see nurses in the media as much. We've been trying to get funding, which we've taken a little pause on, in order to go back and really look at those 3 years and look at the content from both broadcast, print, and digital media. And so our anecdotal reference becomes more data proven. I think it did help. Why did it help? There was still a visibility. But what we've also done as part of our nurse media movement, I'm a 60s chick, so I like to talk about movements, is there have been a core group of us who have been working with chief nursing offices and professional nursing organizations to ask them, let's go to the chief nursing offices, have you been trained in media? Have you been put in front of the camera on vital issues? We also had not only COVID, but we had the Ebola incident prior to that, where nurses were critically involved in the care of those patients. The nurse in Texas who herself, contracted Ebola from caring for someone with Ebola. And again, they weren't really put in the forefront there. And as you said, again, with our physician colleagues, we don't need them to speak for us. We can speak for ourselves. And some of the things, there's some actions that we've been talking to nurse leaders about what they should do. And I think for your listening and viewing audience, there are things they can do. So I don't know when you want us to get on that, but you are subject matter experts. And I, as a health reporter, as a public health nurse, I really believe that journalism and media has an inherent role in promoting the health and well-being of the people we're privileged to serve. So my end point is always that. Yes, I want to elevate nurses. Yes, I want nurses to be seen as expert sources. I want them to translate their expertise so reporters can go to their editors and say, I have this really incredible story about an innovation out of name your institution, either academic or health delivery system. And here's why, because this nurse has been able to translate that research and prove that this will have better outcomes. That's how policy is made. That's how people understand what it is that nurses do.
Well, and before we get into the call to action and what nurses can do, we all have heard stories from nurses about being silenced by their institutions. So I think it'd be good for us to talk a little bit about that also, because there are a lot of nurses who would like to speak out about issues and be content experts, but their institutions do not support them in doing that, which is different from, say, their physician colleagues. So, how do nurses navigate that when they're not getting the support from their institution to be those expert voices?
Well, I think it's got to start with making sure that you know the media policy of the institution that you work at. I would be the last person to ever want a nurse to be in jeopardy for his or her job or their job. It's absolutely critical that you understand what the media policy is. And then maybe if you can't get right to the chief nursing officer, try and find out what do you need to do in order to be interviewed by a reporter? Because you're not only going to be pitching your stories to reporters, which probably if you're representing your institution, and I'll talk for a minute about the private citizen who can talk about themselves privately, but it's just shaky ground. We know nurses who were fired during the pandemic for speaking out and didn't get their jobs back. We also know of a case that I'll reference in a moment about a hospital employee that did get their job back by writing, after they wrote a letter to the editor in a New Jersey institution about unsafe practice. They were fired. It did go to the Labor Relations Board after it went through the circuit on the Eastern Seaboard, and it was said that that was an occupational health and safety issue, and they were reinstated. But that's a lot to go through, right? That's treacherous. Losing your job, wondering whether or not you can pay for the lawyer, et cetera, et cetera. So the first thing I would suggest is absolutely know your media policy. The second thing I would suggest is get some media training and then go to the public relations office. If there's a direct contact for the Department of Nursing, say, I'd like a 15-minute meeting with you. Let them know that you're media savvy, that you're media competent, that you do news analysis, that you read the publications that are important and critical to knowing your region or national news, and that you'd like to be seen as a nurse expert source. I'm going to tell you that most departments don't know what nurses do either, right? So you're already going to educate them. And then if you read an article, like how many, probably both of you, I'll ask you, have you read something in the last couple of days or watched something or listened to something and thought, oh, they got it so wrong, or they got it right?
All the time.
All the time.
All the time.
Tell me, Marion, tell me.
Most things, I think, boy, they got that wrong, or they got that right, right? To your point, I think nurses, we live in all these different spaces. And so I think we could talk to so many different topic areas where we could add a different lens and a different point of view and knowledge and expertise that others might not have.
Right.
And I think, the most interesting thing, actually, I don't know if you know this, Barbara, but 2023, there was over 23,000 nurses in this country who went on strike. Did you know, being in New York was the largest strike?
Yep. Mount Sinai. Yeah.
But you looking at that situation, and I found that that national dialogue that was going around why nurses strike was very different than what was going on in the internal communications of nurses in their own social media, right? Those nuances of why nurses were striking. Often the media portrays nurses as striking over the situation of money. But when you actually drilled down into what nurses were saying, it was much more about ratios and safety and practices. And many of those nurses wouldn't walk back from the strike line until staffing was agreed upon. And I thought for the first time, because nurses really got out there, and I noticed, at least speaking on LinkedIn, that the New York Times published an article for the first time that to me really summarized a view from a nurse's perspective that got the national narrative correct. And I remember around that exact time of those articles, reporters behind the scenes were reaching out to me on LinkedIn asking what was the view of the nurse. And I remember reaching out to you, Barbara, and saying, hey, I have a reporter that's looking to talk to nurses. And that was some of the things we do. That I think for the first time that I had witnessed in my, career as a nurse, the national narrative started to change effectively when these reporters were engaging with nurses directly on the front line. So I saw some changes. It was an exciting time, both amplifying the power of nursing, but the voice of nursing and a national narrative that I think largely happened because of nurses on social media finally getting to be seen and heard by reporters who could bring that to a national conversation in their media sources.
I absolutely agree with you. And it's when we've often said and continue to say that if you interview a nurse, you're going to get a very different frame of the story, and you'll probably get a better story. And we just averted a strike here in New York City on Staten Island. They've gone into contract. I don't know what the outcome would be. That got some coverage, which, is probably a whole other show. But, local news is becoming very contracted. And the fact that a Staten Island hospital had a strike, I know about, not so much from our national papers, but I subscribe to local newspapers because I want to know what's going on in my community. And I would urge all the nurses who are viewing this and listening that you want to know what's going on locally. We all want to be op-ed published in the New York Times and the Washington Post and the Hill, but start locally. Know what's going on locally in your community. Reach out and thank those reporters who are getting it right, as Rebecca just said. And for you, Marion, I too, will write a reporter, and you want to be kind, you want to be diplomatic, which we are, and say, hey, interesting viewpoint. I have another side to this story. Would you like to have a chat? Or next time you're reporting on this is an area of my expertise. There's actually there's another frame to this story. And trust me, reporters really appreciate that as long as there's a civil conversation. And everyone likes to be thanked for getting something right. So how do we build those relationships? Just like you would any other relationship. I often say, local newspaper, invite that person who covers health out for a coffee. Say, hey, you got an hour? I'd love to buy you a cup of coffee. Let them know who you are, that you represent the community they're reporting on and they're serving. I think that's a really important thing. The other thing is to get out of our silos of speaking to each other, and all of the advantages that you are bringing to your Love and Leary podcast and the other media that I know you both do is so that we're educating ourselves, but then we're going out and making sure that we're extending our reach in the media to sources that really need to hear our voices.
Yeah, and I think, it's really important. Social media is a tricky space, and, Rebecca and I have talked about this, but I cultivate so many relationships with local reporters solely from social media. I constantly, like Rebecca, am being DM'd by reporters who have a story about healthcare or nursing and want to be connected with nurses who are in that space who might, have a viewpoint on this. And I am always able to find them someone, and they find me from social media. So, as much as social media can be a mixed bag, it is really a great way as a nurse to get your voice and expertise out there in the world and out there to journalists who might not otherwise have access to you.
Absolutely. I like to talk about taking your space, right? Often we don't take our space. Get out there, take your space. Share your space, of course, with people's voices that are also underrepresented in the media. For me, the role of the media is also about democracy and democratizing the voices that we hear. So if you're not seeing your people and the representation of the communities you're serving, this is not pointing a finger at you by any means. I understand the situations many people are living in. However, as a nurse, as a clinical expert, as a policy expert, as an innovation expert, take that space, be in that space, share that space. Nurse leaders have to speak up, and we're all nurse leaders. It's not related only to your degrees or your title. You are leading the way in your work. And I think it's an important exercise. Like, we do this writing exercise prompt, and we ask people to just keep writing for 3 minutes. Don't pick your pen up. And when I think of myself as an expert and a reporter calls me, and you have to just keep writing. Like, what does that feel like? And get past that. I don't know what to say. I don't know what to say. The other, like, really interesting thing, and I don't know how much time we have left, so just give me a cue here. A lot of people say, oh, I have imposter syndrome. Well, I'm like, okay. Over the last 10 years, it's something that I hear a lot about, and I'm going to just refer to the person's name so I don't blow it. But in June, I love commencement exercises. I don't know about you, but I'm a sucker for a good cry at commencement exercises. For me, it's like being at the airport and watching people hug each other goodbye at the gate, or now at TSA. So I was searching the commencement exercises, and I came across a jackpot. Rashma Sajani is a leading activist, and she's the founder of Girls Who Code and Moms First.
Yes.
She delivered an address at Smith College on May 21st. I watched it many times. And just briefly, it's about bicycle phase. And she goes into the whole history in the 1890s when bicycles were developed and women were riding this gigantic front wheel, and the women were still wearing long skirts and dresses. So, it was not easy until they came with the same two wheels, and also they were allowed to wear pants, I guess. So it was this whole thing that became a medicalized thing. It was called bicycle face. And the medical community actually made up an entire diagnosis that women had bicycle face, and it was some kind of pathology, only to find out that it was nonsense, and that the men couldn't believe the women were hopping on these bikes and riding these bikes they were excited. The bicycle face was like going fast, So hop on YouTube and watch that. There's a whole history of the symptoms they included with it: insomnia, heart palpitations, all kinds of nonsense. And she's suggesting, and I'm going to believe it, and I want everyone to believe it, that imposter syndrome has also been made up as a medical malady that often only impacts women.
Oh. I love that. Barbara, I love conversations that speak to my soul. And I think we all feel this way with regards to feeling like who we are, what our voice is supposed to be, and being tied to being nursing and women. I think we're all trying to figure out what that future looks like so that we don't face that direction of imposter system. And I know we're coming down to like our last 3 minutes. And Marion and I want to make sure that the audience understands what takeaways, what actions can they take when they're looking to get out there. And I think you've given us some gold, but give us, like, if you could, I'm hoping everybody comes and seeks you out after this, because just spending even an hour with you is one of those most transformative events that you can do for yourself personally. But tell us some quick tips for that nurse out there who's scared, but knows they have something they want to talk on. What would you tell them?
Well, if you can even do it with your colleagues and friends, right? Like, what is it that you would really love to talk to the media about? I have a very simple exercise called the message triangle. Other media people use it. It's that if you have an issue and you know what audience you want to direct that issue to, whether it's a policymaker, a board of trustees, a venture capitalist to raise money for your innovation, know your audience. What are their values, their beliefs? And how will you frame your message in order to influence the outcome of that message? And then come up with 3 really strong points. We're great storytellers. We know the data. You don't want to overdo data. People in the public, and maybe some venture capitalists or policy people, will know the p-value, but most of us just want to know 50%, 80%, et cetera. And just take your smartphone even and start talking into your smartphone for 3 minutes and see how well you can get a lot of information out in 3 minutes. That would be one of my first things. And I think we could do peer-to-peer support with each other. if you work at an institution, you may find out they'll give you free media training. So start there. There are institutions that have it available, and let that be the first step. That would be my other recommendation. And start reading the news regularly. I know we're all busy. You can tag the story that matters to you. I follow Stat News every day, Kaiser Health News every day. You know, I'm a reporter, so I read a lot of news in different periodicals and different. I don't watch the news. It's one of my things I can't do. I can't deal with watching news. I can listen, I can read, but something about TV news for me personally just doesn't work. I just find it mashugana. Even some of the better shows. I'm trying to also suggest that nurses, as you've said, Marion, and others have said, we are trusted. We can be part of what we know is a public health crisis of disinformation and misinformation. Don't worry about it being all about you, because it's really not all about you. It's really about what we do best, which is to support the health of the populations we serve. So think about how your role in addressing the myths of disinformation and misinformation is critical to the health and well-being of individuals, communities, and families.
And I do want to just say, if you're not comfortable as a nurse speaking to the news media, that's fine. There are plenty of other ways for you to communicate your expertise, like Barbara mentioned, writing op-eds or being on social media or doing radio interviews. You know, there are a lot of ways to get your expertise out there. So if you're not comfortable with one medium, there's plenty of others out there, but we really do need more nurses using their voices in all of these spaces.
I agree. And the other thing is, you can write a letter to that reporter or write a letter to the editor. Say, hey, that was really awesome. You had a nurse expert talking about diabetes, and it was and why the latest innovations in diabetes should be taught to every patient living with diabetes. I mean, I really believe in our cognitive intelligence, our emotional intelligence, our ability to speak from a place of truth and what we know. And we have a process of creativity as well as in our work. Why shouldn't we be in the media? I don't know. I think we have to stop saying nurses should be in the media and start saying nurses be in the media.
100%. And speaking of Barbara Glickstein, if you guys are lucky enough to live up near the Catskills of New York, you can catch Barbara on NPR with Health Cetera, and MarionHealthMediaPolicy.com. So you guys need to check her out there. But Barbara, this has been an absolute blast to have you on. And I am all behind the nursing media movement, Nurses Be in the Media. Marion, I'm turning it over to you.
Yeah, I just want to thank you again, Barbara, for all of this information. I want to encourage folks to reach out to Barbara, reach out to Rebecca, reach out to me. If you are interested in using your voice in this way, we need you. We want you. We're happy to help you. So we just want to elevate the voice of the nurse in all of these spaces because it's critically important now, really more than ever.
Pitch me a story. Pitch me a story. All of you who are viewing this, you have something you want to say? I'm a really good interviewer. Pitch me a story.
That's it. That is exactly what we're going to do. Thank you guys again, everybody, to tune into us. Our first absolute podcast and section that is going out on the nursingbeat.com. And join us for future episodes as we bring new content forward that we think is imperative to be getting out in front of the nursing community, but more important, having nurses have a voice in that media directly. Thank you guys for joining us.
Thanks for listening to the Love and Leary podcast. We hope this conversation sparked new ideas, challenged your thinking, and reminded you of the power nurses have to lead change.
If you enjoyed this episode, be sure to subscribe, leave a review, and share it. You can find more episodes and join the conversation wherever you do your podcast listening.